The Kansas Department of Health and Environment has a new leader. Governor Sam Brownback appointed Jeff Anderson as acting secretary today.
Our Capitol Bureau Chief Courtney Ryan sat down with Anderson this morning to talk about his priorities. Courtney?
Anderson tells me he's excited for this new role and says he knows CanCare is a major issue, which is why he has ideas on how to improve it. Sitting down to talk about his new role in KDHE, Jeff Anderson laid out his priorities.
Really simplifying the benefit plan so it's easier for the patients to navigate the Medicaid system.
When it comes to CanCare, the state's privatized Medicaid system.
So whether you call it 2.0 or not, we know that there's ways to improve what we currently have.
The state is currently in the process of applying for a federal waiver to launch CanCare 2.0, which would take effect in 2019. Under the proposed version, work requirements would be put in place for some of the 400,000 people receiving benefits.
Only about 11,000, about 2% of the Medicaid population would be subject or potentially deal with those work requirements.
Those requirements are something Sean Gatewood, a representative for the CanCare Advocates Network, says could do more harm than good.
And you're sort of throwing them off when they're already in a very high pressure situation.
Earlier this week, Senate leaders released this statement expressing concerns over CanCare 2.0.
We need to get things ironed out before you add more complicating factors to the program.
Gatewood says issues he'd like to see ironed out include more accountability within the system.
And when they have issues with CanCare, to be able to have some assistance in resolving them.
Anderson says improving accountability with the eligibility clearinghouse and the managed care companies is on his list of priorities.
All those pieces have to work together if the program's going to be as effective as it should be.
Anderson officially starts next week, and it's important to note that the CanCare isn't only overseen. It is important to note that CanCare isn't only overseen by KDHE. It is also overseen by the Kansas Department of Aging and Disability Services. Anderson starts officially next week. At the Capitol, I'm Courtney Ryan.
All right, thank you, Courtney. Now, just today, Kentucky became the first state allowed to impose Medicaid work requirements.